And then I guess what you're thinking as well, is that all? I mean, do you just do a whole bunch of different training and then get involved in working and so on? And actually, as I mentioned just now, that's the core part, and your learning continues after that. And it's very, very important to have an inquisitive mind and continue learning. So I'm just going to share what I've been involved with since I graduated. So this is my first medical degree and my bachelor's here. Then, when I was doing my primary care, I got involved with various diplomas. So I did family planning, child health, and obs and gynae. And then after finishing off my GP training, my primary care training, I did a fellowship in sports medicine. I did the postgraduate diploma in ultrasound because I felt that that was very relevant to my clinical practice. And then me being me, I decided that I also wanted to have an interest, a little bit more of a knowledge in sports medicine. So I did a master's in that and a research project in that. And then I also started developing interests in clinical education. So I did a master's in that and also pain management as well. So I did a fellowship in that. So although the sports medicine training program is very diverse and it does give you a good breadth of different things, we each pick our own different areas of interest and then we work on those. So moving on to what you do as a consultant. So once you've done your sports medicine training, you've finished your fellowship, and you become a consultant, you can have different facets to your career. And so it can range from just sticking to a sports medicine clinic and seeing patients there day in day out. Some people get involved with sports teams, and as I mentioned, one of my good friends and colleagues, he's involved at the national team level. Another friend of mine is the Tottenham doctor. Another colleague of mine is the Liverpool doctor. So, a lot of these people that I've trained with and known over the years, they've gone on to sports teams and they work primarily with those. Some people work with national sports organizations, such as SSI or the Olympic committees as well. Some people have more of an interest in terms of events. So, although they may run some clinical sessions in a sports medicine clinic, their main area of interest is planning and delivering medical care during marathons, for example. And then other people who I've trained with as well over the years, they have not so much interest in the events and the sports teams, but their area of interest is really research and teaching. And certainly, this is something that I was involved in when I was in the public healthcare system as well. So, just to give you a flavor of what, say, I do in my clinical practice, um, these are some of the things that I do and I provide to my patients as I'm, in my clinic. So, I will obviously look at patients with sports injuries, musculoskeletal injuries. We deal with chronic diseases as well. Um, One of my areas of interest and something that I developed a lot when I was here in Singapore is musculoskeletal ultrasound and particularly in interventions. Another area is that's uh, very not new necessarily, but really relevant at this point in time is longevity. And I know that there's been a shift in mindset from not necessarily dealing with disease, but also to aging well and living well. And so the whole concept of longevity is very important. And then I still do involve myself with some team medicine. I'm the team doctor for Tampines Rovers, and last year I was also involved with Lion City, and in addition to that, I also do a bit of exercise management and weight management. So that's kind of the clinic aspect. But as I mentioned before, ultrasound is really an important aspect of my practice. And stemming from that, I started doing a lot more procedures. So injection treatments such as platelet-rich plasma, hyaluronic acid, high volume injections, and I also have an interest in chronic pain. So looking at long-term kind of injury pain, but also back pains as well as patients with more complex pain syndromes as well. So really, what I guess what this highlights is, although we have that core training that we go through, um, it's really your career to develop, and there are many different facets that you can sort of bolt on. So as I said, I guess I have quite a varied range of work. Sometimes I'm doing screenings here in the club. Other times I'll be seeing patients with injuries, and then other times I'll be doing procedures in the day surgery setting. And it does that mix of being able to do different things does mean my week can be fairly interesting. And I don't think necessarily one week is always the same as the other. So. There is a nice variation to the practice that I have. If you are involved in a sports team, you may be involved in as a medic at different levels. So, when I used to work with Wimbledon Football Club, that I was one of the club doctors here. We had another head of medical who would be the liaison point between the team management and the senior club management. Um, we also used to help with the crowd medicine as well, look after the crowd when they were there for matches, deal with the physiotherapist on a regular basis, and also deal with other therapists who are there. So depending on your level of experience, your seniority, you may take on different roles within the sports club setting. And of course, this I describe from the context of a football club. Now, depending on which sport you have an interest, you can extrapolate this to other the areas as well. In terms of event medicine, you can be involved with all sorts of things. And as mentioned before, I mean, these are a few things that I've done over the years. So privileged to have been working at the Olympic Games, Asian Games, and and the Sea Games. Um, I have been working with the golf for a number of years as well, and also the football. And then other things may come across. So things like ultimate frisbee, marathons, table tennis. So, really, for me, I get involved with event medicine because I'm interested in the different sports. I enjoy the different sports and the challenges that it brings from dealing with injuries in these different areas. Dealing with emergencies in different areas as well, and also from a kind of planning perspective, it can be quite cognitively stimulating as well. The recent one that I was involved in was the aquatics event. So I was asked to help out at the open water swimming for a day, and actually it was an interesting event because I didn't realize in Singapore that the currents and everything are quite so strong. And there was the day that I was helping was the masters, so the women's masters, and there was a lady who was 88 and she was swimming 3 kilometers, so quite a remarkable feat for her, but also quite a lot of stress for the medical team who were covering that day. And then you can also be involved in teaching. So when I was at in the public hospital setting, I was privileged and to teach for NUS and LKC medicine. But you can also be involved in teaching for industry as well, if that's your area of interest. You can do stuff for associations or journals, and you can also just take on teaching roles for different societies. So whether it's physiotherapists or rheumatologists, you really can have a diverse portfolio of teaching. So if it is something of interest to you, it's something that you can really develop. And then lastly, research. Research is I think everyone should be asking questions. Everyone should be saying, "Well, how can we do things differently?" Or "Are we doing things to a reasonable standard?" Um, it's important that as a clinician, we do challenge knowledge. We not just challenge knowledge, but we evaluate our own practice and our kind of and the practice in the place where we're working, and we use it as a way of implementing change. So one of the some of the areas that I've been able to undertake research in is concussion, injury prevention, reporting. We've used various assessment tools. We've also done a number of case reports just on really interesting stuff that we've come across. So things like inflammatory arthritis of the spine presenting as hip pain, or somebody who does combat sports who comes in with a obstruction to the blood flow in the leg. So a lot of these things are quite interesting, and it just highlights to other doctors that they should be thinking about these things as they're seeing patients as well.